So this morning I'm going to briefly go over some of the concepts in the field of oncoimmunology and discuss how the immune system can be used as a very potent weapon against cancer. In this very first opening picture, what I have here is these are cancer cells, these are natural killer cells that are attacking a cancer cell. If the attack is successful, this is what we wind up with. We wind up with a hole that is structurally blown in the side of the cancer cell as a result of the activity of the natural killer cell. This is the goal of where we're trying to get to when we're talking about oncoimmunology. There is a quiet revolution going on in the field of conventional oncology. If you look at ASCO, which is the world's largest clinical oncology organization, the American Society of Clinical Oncology, and the NCCN, the National Comprehensive Cancer Network, these two huge organizations feed their protocols into a website that was called chemotherapyadvisor.com. If you go to that website, it's free. You can type in any cancer you wish, and you'll get the latest and greatest off-the-shelf protocol of what they're using to treat that cancer in a very generic sort of way. About 6 weeks ago, they changed the name of their website from Chemotherapy Advisor to Cancer Therapy Advisor. You may not think that that's much of a big deal, but it's huge, because now when you go to the website and you type in breast cancer, lung cancer, whatever, okay, adenocarcinoma of the lung, what have you, not only will you see the latest chemo protocols that they use, but now you're going to see lists of targeted therapies. Targeted therapies include things like monoclonal antibodies, different sorts of tyrosine kinase enzyme inhibitors, hormone inhibitors of various sorts, and on and on. There's a dozen different classifications of different agents that are thought of as targeted agents. If you go to the National Cancer Institute website at cancer.gov and you type in targeted therapies into their website, you will see these classifications of agents that are now used against cancer that are not chemo. There's being a very radical shift that's going on, because now the studies are showing that these targeted agents can have an outcome that's far superior to the chemotherapy alone. And at the NCI website, you will see that they're talking about a new type of approach to oncology where they're using what they refer to as precision medicine. That's where they're targeting the cancer based upon genetic abnormalities, things that we'll talk about in a few minutes. That's all well and good, but it's still only half of the equation, because they still haven't gotten to the point where you all are, where we're talking about individualized or personalized medicine, where you're looking at the individual as a whole, where they just happen to also have a cancer or also happen to have a severe autoimmune disease, where the disease is, in addition to who and what they are as a human being. And when you approach a person as an individual and as a person, then the approach is, of course, going to be radically different, because you're trying to support them in many other ways. But this targeted approach is still an important component of what can be useful to buy time while you're rebuilding and restoring other systems. There was a very important article that came out a few years ago which looked at what happens when you combine conventional chemotherapy with cytokine-induced killer cells. And what they found was that when they combined the immunotherapy, the CIK cells, with the conventional cancer therapy, chemotherapy, that there was a prolongation in terms of the quality and quantity of life of the patients with, in this case, was gastric carcinoma. But if you go to, this is an example of what I'll do through the rest of my presentation, you'll see the PubMed ID in the bottom. If you go to PubMed.com and put in this PubMed ID, this abstract will come up. And along the right side of this abstract, you'll see a whole bunch of articles that are related to it. In each case where I have an article that I'm sharing with you, you'll see a PubMed ID, because that's basically the trunk of the tree. If you start there, you'll see all the articles that are connected that are taking you out to the branches to further study this field. And if you put in this article, you'll see how the cytokine-induced killer cells, the immunotherapy that they're talking about, has been applied to not just gastric cancer, but certainly breast cancer, brain cancer, lung cancer, pancreatic cancer, et cetera, et cetera, et cetera. So this is an important article, because this was one of the first which was able to demonstrate a clear therapeutic benefit from using this sort of advanced immunotherapy. So the immunotherapy is very good. It can be very powerful by itself, but unfortunately it doesn't work as fast as chemo does. And sometimes what I have to do with my patients is, if they're in a very advanced form of cancer, or they've failed other sorts of conventional therapies and their immune system has been beat up, and that's a huge problem from the conventional therapies, that I need to buy myself some time to rebuild the immune system. So the way that I buy that time is by using these targeted agents against the cancer. And there's a couple of different organizations that offer testing of the tumor itself, which will tell you what the genetic alterations are. One of those labs is called Foundation One, and this will give you a list of the genetic abnormalities and also then the targeted agents that can be helpful in stopping the cancer based upon these genetic alterations. The medications that they recommend here are not chemotherapies. Okay? These are targeted therapies. This is immunotherapy. These are enzyme inhibitors, so on and so forth. It buys time. You can learn much more about this at their website, foundation1.com. And it goes on to looking at an even more comprehensive list, as you can see here. Now, one of the advantages of Foundation One is that if you do a test on somebody and it comes back showing no genetic alterations that they can find, then this automatically points me in the direction of another strategy, which is often extremely helpful. This sort of research goes back to Dr. Brzezinski, a name I'm sure that most of you are familiar with, and his discovery of things that he called anti-neoplastins, studying the urine of patients who had cancer and the urine of patients who did not, doing a very careful analysis between the two, finding what was missing in the urine of the cancer patients, these small molecules that he referred to as anti-neoplastins, that when manufactured and given to patients with cancer can slow down or in many cases even stop the cancer. One of those anti-neoplastins of his is phenylbutyrate. Phenylbutyrate is a FDA-approved medication for other purposes, of course, but nonetheless, it is a non-toxic differentiation inducer. It works at the level of the telomeres and other places to repair damage to the DNA and can actually convert a cancer cell back to being normal. Fascinating. Now, but it only works if there's a minimum number of genetic alterations. And the way that you find out if that's the case with a patient is with a test like this.